With flu rates on the rise, doctors recommend making an appointment for your annual vaccine before you get sick and find yourself wishing you got the shot.
It is definitely setting up to be more of a concerning season.
The CDC estimates at least 880,000 cases of the flu so far, the highest report seen this early in the season in the last decade.
What we've been noticing more and more, countries that have had either reduction in masking or drop in rates of flu vaccination have been more blindsided by the almost like the overall surge in influenza.
And health experts predict even higher levels of flu activity, looking at the lack of guidelines and restrictions in public places.
Not only for COVID-19, but also important for a lot of these respiratory viruses. And so when we hear like last year or the year before that flu rates have dropped or declined, individuals were like, well, I don't need to get my flu shot. And that kind of mentality is now stuck.
Dr. Nistico is urging people to take the steps to protect themselves from winter illness.
You want to try to get that vaccine so that you're in preparation for the months when flu starts to pick up.
But influenza isn't the only illness to think about.
Omicron strain as well as the older strains of COVID-19, like the original COVID.
Luckily, people have the option to get all of their vaccinations out of the way in one trip.
Flu shot itself can be given in terms of that the same day, can be given the same day as the COVID-19 vaccine. It is a personal preference. There is no harm in receiving both shots at the same time.
Everyone 6 months and older is eligible for their annual flu shot, and people ages 5 and up can also get their COVID-19 booster shot. Doctors recommend getting vaccines in different arms to limit any lingering soreness. For Arnot Health, I'm Lexi Cutmore.